speak on Hinduism, we talked about it.
Yes, yes.
Namaste, Dr. Sarkar. This is
Oh,
Vimla.
all the people I know.
Long time, I know.
Very nice,
I
very
have
nice.
attended your yoga classes.
I'm extremely busy, Sri. You know, I'm present. Just now I talked to the one in Sri Lanka. I'm going to present one in Sri Lanka. Now being home, presenting from all over the world now.
Yeah, I see. I know you are very busy.
Thank you. Thank you for finding me.
Oh, thank you for this. For finding some time for us.
No, we always say that. So catch me if you can. You have to catch me, you know.
So I had fixed this about 3 months ago, and then it's
this one is
okay. Whenever you're ready, you can let me know.
Yeah. So everyone, just make sure that there's no only group conversation, but not and Dilip Sarkar is going to start pretty soon. It's 2 minutes after 10. And it's really nice. It's a privilege to have him here give a session. And Dilip, I just wanted to mention that we have about almost 30 teachers that have recently taken advantage of this COVID environment, and they have graduated. Some are RYT 200, some 300, some 500. And so they are also looking forward to some guidance from you about some more development in yoga therapy, and also you have many other students that are going to attend the classes, and also your good friends here. So with that, we can start it. And Dilip, if you want to record locally, that's fine, but I'm recording it anyway.
I'm going to record on my computer, and you put me on a spotlight now.
Yes. So Dilip Sarkar, I'm going to put him on the spotlight. You can have the videos on.
Make it spotlight for all.
Yeah, I'm going to do that. Just I wanted to tell everyone that make sure your audios are off. It's okay if you have the videos on, and there may be some practice sessions, so it's okay if you have your videos on for the practice session. All right.
Yes. In fact, we like you to keep your videos on, so we can also monitor you. Okay. So thank you, Sri. And it reminds me of all the pre-pandemic days in Washington, D.C. I'm not too far, I'm about 3.5 hours from D.C. and I've been here about 45 years in this area. So today, as we were saying, that we have all the new yoga teachers. We have very seasoned yoga practitioners with us. We have a long-standing yoga therapy teachers with us. And one of my interests, and I can tell you is one of my specialty today, is how to integrate yoga therapy in Western medicine. I've been doing it for a long time. Few people might know here, and Sri knows very well. I've been with a association in Washington, D.C. called Life in Yoga, Rajan Narayan, myself, and a teacher from Harvard, our Sadhbir Khalsa. We have been teaching the physicians, actually started the first ACCME, it's called Accreditation Council for Continuing Medical Education, for the physician continuing medical education, yoga therapy for healthcare providers, started in 2010, almost 11 years, and we're still continuing. We'll be doing it twice a year, May and September. Now it will be all in online. And I just want to tell you one more thing. I've been a president of International Association of Yoga Therapists for 5 years, and we have introduced a standard accreditation certification, and we made the yoga therapy as a separate specialty, as a part of called integrative medicine. Now, let me take a few moments, maybe a few minutes, because of the teachers and what we are talking about and where we start and where we go. That will be a nice practice session. You will see how do we do the practice session, how to integrate. First of all, if you are just a brand new graduate of a yoga program, and if you're in a yoga class or yoga studio, I can guarantee you 75 to 80% people will come to you for an underlying chronic medical condition. They're not going to come to say, I want to just learn how to have asanas, how to do some pranayama or meditation. So your approach will be what is called a therapeutic yoga. Now, historically, all of us will know that yoga is a spiritual practice. When we as a physician, we have a few other physicians also in the audience, we as a physician started incorporating yoga in our daily practice, in our daily patients management, we got a big uproar, called medicalization of the yoga. We're not talking about medicalization of the yoga. What you're talking about, it is a part of what is called integrative medicine. What is an integrative medicine? Integrative medicine today is defined as a wisdom of our traditional system of healing, primarily yoga therapy, with the science of our modern medicine. We're not rejecting anybody. We're incorporating, integrating for a better outcome. Look at the modern medicine. Modern medicine is great for all the acute care, but it has failed tremendously for chronic diseases. Simple back pain, migraine headache, you can name it, diabetes, hypertension, high cholesterol. You're carrying this burden. This is called a morbidity. What a daily practice of yoga will do is called a reduction of morbidity. So before we start, let me go over with you, especially the new teachers, the questions people are going to ask you on how to incorporate yoga in your daily health care. The first, as you all know, that the word yoga means union, is the union of your body, mind, and spirit. It's a philosophy, Yoga Sutra Patanjali. Think about 196 sutras, of which 193 is how to quiet down your mind. Chitta Vritti Nirodha. Practice 8 limbs. And you have to all remember by heart, Yam, Niyam, Asana, Pranayam, Pratyahara, Dharan, and Samadhi. And it was designed for self-realization, outcome of self-realization. It was never designed for any therapeutic outcome. But during the process of the practice, we started seeing a lot of health benefits. And primary health benefit we saw is that Rogir Chikitsha, treatment of a disease, and the Shwastarokha, maintenance of health. This maintenance of the health is called the resilience. I did a program yesterday, yoga therapy, called Building Resilience. Resilience is like that. You have like elasticity. You have a stick. If you bend it, let it go, it will come back to normal. This is called your default mode network. We call it a reset mode. Our body has their own healing power. You let the healing power, you learn how to activate the healing power, then you bring the health. Health is a balance of your body, mind, and spirit. So a proper well-being is a balance of your physical, mental, spiritual health, and able to unlock, remember, able to unlock the ability for your body's own healing power. Our body produces every medicine you take. You take a beta blocker, you take an ACE inhibitor, you take an aspirin, you take a statin. Our yoga practice will generate everything. We call it a medicine cabinet of our mind. From a computer standpoint, if you look at a computer standpoint, my body is the hardware, mind is the software, spirit is the programmer. Who is the programmer? I am the programmer. I program my software to fix my hardware. So practice of yoga is going to fix your software. So hardware will get fixed. In a Western medicine, we are always fixing our hardware. And we have a tremendous lack of outcome. So for all of you, what we'll need to understand is that yoga therapy is an adaptation. And what was the adaptation? That during the process of your practice of Patanjali Yoga Sutra, Patanjali Ashtanga Yoga, it was infiltrated with the mudras, bandhas, kriyas, Ayurvedic philosophies, and it became what is called the Yoga Chikitsa, yoga therapy. So what is a yoga therapy is, and what you are as a yoga therapist means, why you are so interested, and why do you have such a long training program? You can be a yoga teacher in 200 hours or 300 hours of teacher's training, but for yoga therapist, only 800 hours, 1,000 hours, some places 1,500 hours. That you are able to learn how to pick and choose the same practices from the Yoga Sutra, from the Ashtanga Yoga, and use it appropriately for the person who has underlying physical condition. A person comes to you with a physical ailment, comes to back pain, knee pain, hip pain, you learn how to take care of that. People comes to the respiratory issues, comes with asthma, COPD, pulmonary fibrosis, you know how to approach them. People come with the mental neuropsychiatric disorders, you know how to approach them. That means you are not bound by the so-called rules and regulations of the yoga practice, which you are used to doing it. We are doing yam, niyam, asana, pranayam, pratyahar, dharan, dhyan, samadhi. This is our regular practice. But you will see now, what I'm going to show it to you, that we'll be incorporating mudras, bandhas, kriyas. We'll be incorporating our daily lifestyle. It's called dinacharya. We'll be incorporating your lifestyle as a part of yoga therapy. Now let's face it. Here is a person comes, you are in your class or you're in the studio. The doctor asks him that, yes, you have a diabetes, or you have a back pain, or you have hypertension. Please go and see that yoga therapist. He or she may not even heard what yoga is. We see it all the time. The orthopedic surgeon sends a patient to the physical therapist. When they go to physical therapist, says, why I'm here, what I'm going to do. Physical therapist guides you. Here a physician sends a patient to you. Because today, we as a physician, we look at the data. National Library of Medicine. The data comes from PubMed. If you go to Google, if you do PubMed, if you just put in the search engine, yoga therapy, you will get over 5,000 articles, yoga therapy for various medical conditions, and these are all PubMed approved journals. These are not the throwaway journals. These are approved journals. Present day, if you do COVID, if you put a just yoga therapy for COVID-19, you'll say last time I saw a few months back, about over 55 articles. I just had a beautiful article, a Brahmari Pranayama for COVID-19. A very prestigious journal, Indian Journal of Otolaryngology. because a nasal breathing secretes called a nitric oxide. We'll come about that. Okay, here comes the first person who has never seen, never done yoga, coming to you. I have a chronic low back pain. My doctor asked me to start yoga. The first practice you do in yoga practice is the first two components. In Sanskrit, it's called Merudanda Achal and Manasthit. Merudanda Achal means you have to keep your spine straight. And the reason for that is the outcome of a practice of yoga is called relaxation response and activation of parasympathetic tone. What does it mean? I'm exercising. Why should I do yoga? Exercise is a muscle contraction. Exercise is a sympathetic overdrive followed by parasympathetic activation. What does it mean? In exercise, my heart rate goes up, my blood pressure goes up, my respiratory rate goes up higher, my blood sugar goes higher, my muscle gets into a state of contraction. It is called sympathetic overdrive. Our body has a homeostasis, body has a default mode network, then it brings a parasympathetic activation. So after exercise, what I do, I look at my pulse, how low is my pulse? That is called parasympathetic, calm and digest. In a yoga practice, what we do, we stay in the posture. We hold the posture for an extended period of time to bring the relaxation response. See, our skeleton. So yoga therapy practice is a primary activation of the muscle relaxation instead of contraction. It is a primary activation of parasympathetic tone. And the reason we are saying with a physician, see, this day we are doing it for a long time. This is our health tracker. This is the Apple Watch. And you know what it is? It is recording my heart rate, my blood pressure, my EKG, my sleep tracker, everything is all recorded here. And I'm doing it, I always have it with me. So you're telling you from a physiological data which you have collected. So how to elicit the relaxation response? My skeleton, if you keep it, always will fall in the front. The muscles in my back, called paraspinal muscles, this muscle keeps contracting and keeps my spine straight. So when you put your hand, there's a two pieces of stone sitting here. So what we need to do, we need to keep my spine straight. I sit down, if I can sit down in the ground, we're sitting, there's a nice Siddhasan, and I'll show you how to get into slowly in different asanas. Asanas will come to you. You don't have to ask for asanas. If you're sitting in a chair, sit down in a chair, sit all the way to the back. Always keep your spine straight. And remember, yoga as a therapy is not that 1 hour of practice you do. Yoga therapy is out of the mat. What you do for next 23 hours. It is a state of mind. It is a way of being. It is the wellness which carries with you all the time. I'm sitting here, the Sukhasana. Next, what you do, if somebody is like, sit in the ground, sit in a chair. So let's get a chair. See how to show it to you, how to sit in a chair. When you sit in a chair, so this is a regular chair. So you sit in a small regular chair, and we'll show it to you how to sit down in a chair. You will sit in a chair, you'll sit in the front, but you'll keep your spine straight. If you even go to the back, keep your spine straight. That's the way you will sit down all the time. That's the way you sit down when you are having your dinner. That's the way you sit down when you're driving your car. This is the first act for yoga therapy, Merudanda Achal. Somebody says, my feet doesn't touch the ground. Put a folded blanket, put something, but always keep your body in a right angle posture. This will start this yoga therapy practice. For us, what we do, and I've been doing it for a long, long time, let me show you what I use. I use what is called a kneeling stool. You should see all of them. This is a wonderful, I have it for years and years. I will sit down always in a kneeling stool. I sit down in a kneeling stool like this. And I'm using my computer. These days, we're always in the front of computer. I'm in front of the computer. I'm in front of sitting down. I'm always in a kneeling stool. And I have two of them. You know, every table I have a kneeling stool. So when I touch my back, I have two like a soft pillows here. The tightness of my back is gone. Also remember the back pain. We have a neurologist here, he knows. The back pain is not due to your herniated disc, not due to your spinal stenosis, it's irritation of a nerve. It's a contraction of the muscles which causes pain. So for a back pain, if you give a pain medication, it doesn't work. What it works, it's called muscle relaxant. So yoga therapy practice the muscle relaxant. So incorporate spine straightening all the time. See what I will do. I'll get up in the morning. I'll keep my body straight. I'll go maybe against the wall. I'll go in the morning, I'll go against the wall, my heel, my hips, my neck, and the head. My whole body is straight. I wake up in the morning, I put myself. When I walk with my ear, Tadasana, shoulder, hips, ankle, all in the same line. So, keeping your spine straight is the first beginning of your yoga therapy. And remember, when a person comes, you are a yoga practitioner, okay, let's start. We'll do a set of sun salutation. We'll do a few Kapalabhati Pranayama. We'll do Vipassana Pranayama. But the patient will say, thank you, goodbye. They will be gone. You have to meet the person where they are. You have to bring them slowly in stages. We call in stages, impossible become possible. Do not practice any physical posture asanas after a pain medication. Do not start with the pain medication because you sit down. You are sitting down, you are putting a Sukhasana. Put the knees underneath your knees and put it down and you feel pain. The moment you feel pain, you have crossed the balance of the physical body. So what you need to do, you come to a posture where you don't feel pain, but you feel what is called a comfortable discomfort. And you stay in this posture. What it does, it's called neuroplasticity. Our brain will get a signal and brain slowly will allow us to sit down like this. And remember, I'm sitting like this. My brain is allowing me to sit like this. Why? Because I have given a repeated input in my brain. It takes about 20, 30, 40 inputs to get the neuroplasticity. When I am sitting in a posture, in asanas, remember this is a very important stages of the asanas. In Sanskrit, it's called arambha. Arambha is the beginning. In a beginning, the muscle will contract, ligaments will tighten up, it will let me come to a posture. If you stay in the posture, then I will go by slowly. How do you stay in the posture? If you stay in the posture, the muscle starts to relax. Before relaxing, muscle goes a little fasciculation. It will have a little twitching. That is called a sthiti. And the only asana who is a therapeutic asana is called sthiram sukham asana. This asana, I'm sthir. There is no fasciculation. I'm sukhi. I'm very comfortable. That asana. Finally, it's called a visarjan. Visarjan means the profound relaxation. Arambho, sthiti, visarjan. Visarjan is a therapeutic asana. Next, what happens? All the ailments of the bodies and the maintenance of the health is due to our balance. Our balance only comes when you activate both sides of your brain. I'm right-handed, right-footed. I'm always using my left brain. You have to learn how to use your both sides of the brain equally. Why? As simple as it is. You have a cycle. You have a motor, you have a bike. If one tire doesn't work properly, the whole system is not going to work. So you have to have equal pump and equal work. So if I'm sitting like this, what I do, I change my foot. I sit down in the opposite. If you're practicing with me, try that. See what will happen. You feel uncomfortable. You're uncomfortable on the posture when you are sitting like this. So what do you do in yoga therapy? You practice it for a longer time. Next thing, what you do, you need to quiet down your mind. How to quiet down your mind? Your hand is the connector between your body and mind. Mudras. So hand mudras are the wonderful therapeutic outcome. In fact, I'm doing a program for Sri Lanka end of this month. Neurophysical outcome of the mudras. Think about it. Something you like. What do you say? You say this before you can talk. Or if you want something, your hand will come up before you can say, give it to me. So in your hand, you will see always, people will put their fingers together. This is called Hagini Mudra. Try it. Touch tip of your fingers. This quiets down your mind. It puts a focus. I've seen so many times. I'm talking to somebody. I'm talking to them. My hand will come like this without me knowing. I've seen it. I've done so many candid camera. Somebody is listening to a conference, paying attention. Hands are like this. Hagini Mudra. Practice Hagini Mudra. When your mind is agitated, you do a mudra. It's called your Shankha Mudra. In two hands, try this. If you want to do with me, see, these are the way you approach in a patient who has no understanding. They also have an underlying panic, fear, and anxiety when they come to visit you. Shankha Mudra, right hand wraps around the left thumb. Left hand wraps around the right hand. Touch your index finger and thumb. This looks like a Shankha, conch shell. Shankha Mudra. Try it. Do the opposite. Remember, always balance the opposite. Left hand touches your right thumb. Right hand wraps around your left hand. Touch your index finger and thumb. Shankha Mudra. Then what happens in yoga therapy now? I'm in a profound level of relaxation because mind is quieting down. I go for the next step. It is called your Siddhasan. Take my heel all the way to the back. I take my foot in the top and look at that. My knees drops down on its own. I don't do anything. If my knees up here, I let it be here. Because if I push it down, what will happen? It will go back high up like this. But when my mind quiets down, when I develop that arambho, sthiti, and visarjan, when I develop the sthiram, sukham, asanam, this thing is going to happen. Then we access our subtle body. What is a subtle body? Subtle body is the body of my mind. Gross body, subtle body, and causal body. Sthula sharir, Shukha sharir, and Karana sharir. Sthula sharir is the physical body. Shukha sharir is the mind. Karana sharir is our spirit. So what happens when I close my eyes, I can clearly see my whole body. With my eyes closed, I can see my hand, I can touch tip of my nose, I can touch my left thumb, I can touch my right great toe, touching my left knee. I don't have to see anything. I'm clearly seeing. In fact, I'm clearly seeing my body. I'm clearly seeing my body. I'm in Baltimore. I'm in a Life in Yoga. I'm in a CME. I'm entering the door. I'm in the class. I'm starting teaching. Clearly I see my body. What does it mean? What does it mean now is that the mudras you've been doing, see if you can do it with the eyes closed. Try this. Eyes are closed. I'll take a look at me. My eyes are closed. My right hand wraps around my left thumb. Left hand wraps around my right hand. Touch index finger and thumb. I don't need to see. So what happens if you don't remove the underlying pathogen from your subtle body? There will be no permanent cure for the chronic lifestyle-related disorders. Left hand wraps around your right thumb, right hand wraps around. It's a wonderful practice. Keep doing it, and you will see all the patients will love you. All the patients will keep on coming to you. Balancing both sides of the brain. Shri Mudra or Dhenu Mudra. Two hands. I will be touching the opposing fingers. My right index finger will touch left middle finger. Right middle finger will touch left index finger. Right ring finger will touch the little finger. Right little finger will touch my ring finger. Both the thumb. It's like an udder of a cow. Shri Mudra or Dhenu Mudra. Touching opposing fingers in your hand, activating both sides of your brain. Do it opposite. Left hand, left index finger will touch right middle finger. Left middle finger touches right index finger. Right little finger touches left little finger touches right ring finger. Left ring finger touches right little finger and the thumb. Now look at accessing subtle body. Before subtle body, okay, let's proceed. From here, see, now remember my software. My mind is getting fixed. You know, these are like, you know, you have an iPhone, you get those software updates. So yoga is the software updates. Now you can put your feet high up, sit down. This is your Ardha Padmasana. Now you get a pain. You get a pain, you back off. Find a posture where you don't have any pain. So if you take a pain medication and if you keep practicing your asanas, you lose this protective phenomena and you hurt yourself. So somebody says, oh, he's an opium addict. You know, he's taking a pain medication and he came for it. It's fine. Put him on a chair. Don't let him do to physical posture. Slowly do his breathing. And I'll show it to you how to introduce your pranayama also very slowly. Another concept you have to learn is that the 5 koshas, Annamaya kosha to Pranomaya kosha to Manomaya kosha to Vijnanamaya kosha to Anandamaya kosha. Any imbalance you create in the physical body, it will show up in your breath. Pranomaya kosha. So what will happen? You will be like me. You are in any posture, you'll be able to talk. You may be able to sing even. Because you have to have effortless breathing. The moment you put an effort in breathing, that's not a therapeutic yoga. Whole yoga practice is called the effortless ease. Disease, D-I-S, space here, disease, the treatment is called an effortless ease. I'm doing, and this is my 24/7. Activating one side of the brain, go ahead and activate other side of the brain. Now what you do, my eyes are closed, I'm activating my subtle body. I'm going to do a Hagini Mudra with my eyes closed. My eyes are closed, I'm touching the right index finger to the left middle finger. Right middle finger to the left index finger. Right ring finger to the left little finger. Right little finger to the left ring finger, touching the thumb. I'm in a comfortable situation of doing, activating both sides of my brain, even in my subtle body. This is therapeutic yoga. I teach everybody, start using your left hand. If your right hand is using, first start using brushing your teeth with the left hand. When you start brushing your teeth, what will happen? Your brush will be all over. You'll never come close to your mouth. Slowly, when you bring it, I do it all the time now. You'll brush with your left hand, you're brushing your teeth. You know what will happen when you brush your teeth? Your hands, right hands will be doing like this. Why? Because the brain has a signal, you brush with the right hand. I do everything with my left hand now. I'm almost ambidextrous because of my practice. And look at what is happening now. Now I will be sitting in a Padmasana, lotus pose, but I'm in a profound relaxation response. A person who will say, if you get into the, if I could get into the Padmasana right away, but if you're in Padmasana right away, oh, look at that, how difficult it looks. Oh, it is so painful. So immediately I come off. No, you go in stages. So in stages, impossible become possible. So when I am there, and look at me now, I think Vinod will appreciate me more. I have a saliva in my mouth. I've been talking to you for the last 40 minutes. Didn't drink it, didn't it? Saliva is called parasympathetic activation. When you get scared, when you're fearful, you get a dry mouth. But in my practice, I'm activating my parasympathetic tone. I'm activating my parasympathetic tone, so I will be able to sit down comfortably. And people always ask me, oh, I'm 39 and holding on my chronological age, but I'm practicing medicine for 50 years, so oh, at your age, how can you do all this stuff? I do it because I practice it daily. And look at that. When you are in a relaxation response, when you have an activation of parasympathetic tone, you feel a sense of levitation. Put my hand on both sides. I just push a little bit. My whole body will go high up, stay high up. Tulasana. I can stay here for a long, long period of time. I'm talking, I'm breathing, I'm totally effortless. It's not doing asanas. You prepare yourself, your body and mind, asana will come to you. Hand mudras. Next comes your mind. In yoga, what is mind? Mind is a content of your five senses. I see, I hear, I smell, I taste, and I touch. If you put all the contents of the five senses, it becomes your mind, manomaya kosha. When contents of the five senses become processed, it becomes your buddhi. That is a wisdom. That is a vijnanamaya kosha. When that buddhi becomes more processed, it becomes your wisdom. That's your anandamaya kosha. So wonderfully explained, and you feel it within yourself, all these things. So the next one will approach that how to quiet down your mind. Way to quiet down our mind is to able to activate the power of breathing. Lung is like a balloon. It has a 6-liter capacity. it needs 1.5 liter to keep the lung open. The 4.5 liter of air which you can exchange by a good controlled respiratory breathing. But normally, we call tidal volume. The air we breathe in is only 500 cc, half a liter. 80 to 90% lung is reserved. And we activate that. Next is all the muscles of respiration are called skeletal muscles. They can be trained. You know, like you can take I have this dumbbell here. This is my gym, I have my treadmill, I have my bench, I have my weights, and next to that, I don't know if you can see it from the distance, that is my Patanjali. That is a statue of my Patanjali. I got it from India, and it stays here. This is my place. Nobody bothers me. I practice here. I'm from took it from the whole world. So you learn first yoga practice how to breathe out. See, you are here. First we'll say, take a deep breath in. All this air is sitting in the top of the residual carbon dioxide sitting here, which is almost no use, because that is called a dead space. So first we do a relaxation. And we learn yoga from the babies. So in the hand is called Balo Mushti Mudra, the way the babies are relaxed. See, if I relax, your hands get separated. Look at the fingers. Fingers will be separate. When I tie, the fingers will be tight. Relax, fingers will go like this. These are all the signs of relaxation. These are called your emancipation. So if you look at a baby will close their hand, they'll put thumb inside and close. Try this. This is called Adhi Mudra, Balo Mushti Mudra. You can put your hands in the front, you can do it. Do the breathing. Breathe out first. Take a deep breath in. Do the Adhi Mudra. Close it. Do the eyes closed. The moment you do the eyes closed, you get a wonderful practice. Ribs gets tightened up. Breathe in, breathe out. Mani Bandh Naman. Mani Bandh Naman is your wrist relaxation. You relax your shoulder. You can put your hand in the shoulder, put your elbows together, breathe out first, take a deep breath. Always remember, listen to your body. See, it is not a competition. It is listening to your body. If you come up to here, you feel pain, back off. If you feel pain here, back off. Start where you can start in effortless, pain-free practice with a normal breathing. For us, we can come here, it's okay. Breathe out first. Take a deep breath in and slowly rotate your shoulder. It's a ball and socket joint. It looks like a wonderful relaxation practice. It looks so simple. The people might say, what is happening? But it is a profound therapeutic outcome. Do opposite. Breathe in here, breathe out. Breathe in, breathe out. It's a wonderful practice. You do that. I will do it in the neck, called Brahma Mudra. Upper part of the body, called Paschim Namaskar. This is the way we bring people in our therapeutic outcome. Always remember, yoga practice is a holistic. It's a global. It is not a reductionist. So when you come and say, I want to do yoga therapy for diabetes, you're the hyper. Oh, sure. I have everything for diabetes, but you need to start a global, holistic way at the beginning. Otherwise, you will never get any therapeutic benefit. The whole Western medicine is reductionist. I have a pulmonologist, I have a, cardiologist, I have a nephrologist, I have a neurologist. Yoga therapy is a global, my whole body and mind. When I learn how to relax my neck, my back muscles get relaxed, my knees get relaxed. Chronic pain comes from tightness. Remember, people call arthritis. Oh, my joint is gone, my cartilage is gone. Your cartilage is gone, but cartilage doesn't have any pain fiber. What it does, body puts in a, call your splinting. Body, if you've broken bone, what do you put a plaster cast plus body? It tightens up your ligaments, tightens up your muscles. Remember, all the nerve fibers for the pain are in the ligaments and the muscles. So now I have a problem with both my knees, but able to do this, I'm able to live a comfortable life with the underlying osteoarthritis, underlying damage to both the knees. It's not bothering me. But I have the underlying condition. I learned how to live with my morbidity. This is called a compression of morbidity. We are going to have a wonderful life. And the day comes, we'll drop dead. I do a Hagini Mudra, then I close my eyes, keep my spine straight. I breathe out first. Take a slow, deep breath in. Then I breathe out longer than breathing in. Take a deep breath in. Breathe out longer than breathing in. Inhalation is sympathetic, exhalation is parasympathetic. Purok, Kumbhak, and Rechak. Then if you want to count, you can do count of 3 in, count of 6 out, count of 4 in, count of 8 out. We have been doing it for so long, we can do easily count of 10 in, count of 20 out. You won't see any change in anything at all us. I've lived with so many yogis. You will be sitting next to me, you'll be breathing, you will never even hear he or she is breathing. So let me show it to you. I know you want to see it, what the practice looks like. Let me breathe out first. I will breathe in, count of 6 in, count of 12. And see, it reduces your respiratory rate. Normal respiratory rate is around 15 to 16 per minute. If I can even take 2 seconds in and 4 seconds out, 6 seconds for a cycle, our respiratory rate drops down to 10. If you can do 4 seconds in, 8 seconds out, it will drop down to 5. And see in all the animal world, animals who breathe faster, they die early. Animal who has a slow breathing, they live longer. Then when you practice this slow breathing, your neuroplasticity sets in, your brain sets in. So even breathe like that when you're sleeping. My wife always tells me, yeah, I see you when you sleep. Your exhalation is longer. Okay, let me show it to you. 6 seconds in, 12 seconds out. Breathe out first. Very easy for me because I've been practicing daily. I can do 8 seconds in, 16 seconds out. Sorry. All the disease will be scared of. The disease will say, I want to come too close to this body. That is called resilience. That is called your Shastarokha. 3 stages breathing called Dirghoshash. You fill up lower part of the lung, middle part of the lung, upper part of the lung. When you're lower part of the lung, your abdomen goes up a little bit. Middle part, your chest expands. Upper part, your clavicle goes high up. When you get a 3 stages breathing, that's a sign of your health. When you have the sign of the health, this is what comes to you. A Brahmari Pranayama. In a Brahmari Pranayama, you shut down all of your five senses. Then you create a frequency, sound of a Brahma, B. Your brain has a frequency. And we have a neurologist here, and he understands very well. The two frequencies, when they collide, it's called a harmonic resonance. In a harmonic resonance, either all the frequency quiets down or frequency accentuates. You might hear the story, Tanshan. Tanshan used to sing and break a glass. What is the frequency of his singing and the frequency of the glass? It cracks in harmonic resonance, it breaks. So in a Brahmari Pranayama, your total mind quiets down. So practice the Brahmari Pranayama. Do it a couple of times. Let me show it to you. Index finger in the forehead. Use your three fingers to close your eyes and the thumb close your ear. And close your mouth. Your eyes are closed. Mouth is closed. Ears are closed. Always breathe through your nostril. Do not breathe through your mouth. Mouth is for talking and for eating. We'll breathe out through your nose, breathe in through your nose, and breathe out with the sound of a bumblebee. Then do pumping and cupping. Take both the hands, keep rubbing. Keep rubbing your hands, keep rubbing your hands. When you feel the warmth in your hand, if you're wearing glasses, remove your glasses. Take the hands, put it over your eyes like a cup. Let the eyes take all the heat from your hand. It relaxes the ciliary muscles. Ciliary muscles are relaxed. Your lens get more convex. You don't need the reading glasses. I've never seen a yogis wearing glasses, including me. Massage your forehead. All the muscles and facial muscles are attached to your skin. It takes out all the wrinkles, all the lines in the forehead. Massage your face. Massage your ear, behind the ear, in front of the ear, inside your ear canal. This is called the auricular branch of a vagus nerve. It activates the vagus nerve, which is a parasympathetic activation. Bring your hand, massage the front of your neck. It's called massaging your carotid sinus. Carotid sinus activates your parasympathetic activation, massaging the back of your neck. By the time you do this, you'll be amazed how easily you can do a Surya Namaskar, or how easily you can do even your Shirshasana, Sarvangasana, Halasana. For me now, I'm in a state, you name an asana, I can do it. I do a perfect headstand, I do a perfect shoulder stand, because it all came to me. So then, when you are going to practice, you'll see the balancing in both sides. So if you do say, how balancing both side asana will be, see we're doing a Gomukhasana. You're doing Gomukhasana cow face, you put your one knee on the top. This is called Vaisasana. Left in the top, left hand goes high up, right hand goes to the back. Okay, let me show you to the back so you'll understand why it is such a powerful therapeutic balancing asanas. When I'm able to sit down like this, my ankle is relaxed, knees are relaxed, hips are relaxed, my whole body, lower part of the body is relaxed. From here, okay, my left knee is in the top. My left hand goes high up, right hand comes in the middle. So my hand will come down, I'm touching it, hooking it, I literally am handshaking each other. And I'm here, I'm talking, I'm breathing. I'm totally effortless. I can stay here minutes, hours, anytime. This is my effortless ease. I'm breathing out longer than breathing in. Next, you will see the most fundamental principle of yoga therapy. Now, my right knee is in the top. My right hand goes high up. Left hand is here in the middle. Let me just put the left hand in the middle. My right hand comes down. It touches, it hooks, and handshake each other. Look at, I'm equally on both sides, properly relaxed. I can able to sit down here for as long as I want. For you, you will see your one side is easier than the other side because the lateralization, the lack of balance, creating all the disease process. You can do all laying down asanas and when relax, you can do what you want to show. We have a lot of good yoga teachers here. Mayurasana, Mayuriyasana, you can name asana. I can do very aspect, I've been always being introduced. He's the one doing a Mayurasana, he's talking, he's breathing. But it came to me as if, or you see, if you can sit down, this is a wonderful yogic practice. This is called a malasana. If you can sit down in a malasana, which I do, I wake up in the morning, first thing, called Ushapa. Sit down in a malasana, I drink a glass of water, preferably from a copper vessel, sit down. Within a short time, I have a bowel movement. Proper sign of health. Strong digestion, easy elimination, a good night, dreamless sleep. From here, I put my hands together, separate my fingers. That's where my hands are relaxed. Extend my wrist, put one elbow inside, other elbow inside. I stay here. From here, as a primary therapeutic yoga, is able to get up without a support. If you can get up without a support, this is your sign of your health. And let me show you few more signs of health. It is absolutely wonderful before you practice. Sign of well-being, sign of health is able to sit down comfortably and able to get up unsupported. And you practice all the time. You go against the grain of your habit to activate the opposite side of the brain. So I'm comfortable standing like this, so I try putting both the feet together. My ear, my shoulder, my hips and ankle in the same line. Mountain pose, Tadasana, Dandasana, hand goes high up. I mean totally, what was mine? Spine straight, Merudanda Achal. When I fall down, I put my hand first. A special fracture called a Colles fracture. My hand, my eyes creates a balance. I'm a right-handed. Let me take out my hand. It's a wonderful posture. It is called a Paschim Namaskar. Put your hand to the back. Put a Paschim Namaskar. Now see if I can stand on my left foot. I'm standing on my left foot. When you initially try, it will be almost impossible for you to do it. 10 seconds, 20 seconds, 40 seconds. I'm able to close my eyes. I can do it. If you can close your eyes, stand on one foot with the hands in the back. This is a sign of your health. This is a sign of controlling every underlying chronic diseases you have. Do it in the opposite side, the right foot now. standing for a long time. Initially, you may have to hold a chair or hold a hand. Close your eyes. You still get wobbly, almost impossible initially. Then what you do, put a proper balance, cross your feet. Crossing your feet, if you can sit down and get up. I can guarantee you, this is called money back guarantee. No disease will come to you. Cross it opposite side. We have the health tracker here. I'm watching my health when I'm doing it. So I'm not telling you from without any data. Sit down, get higher. Ultimately, what a lot of cardiologists have done, if you can get up unsupported from the ground, that is your cardiovascular tolerance. There's a cardiologist in Brazil. He has done about 4,000 patients. Look at that. Try this. If you can do with me, it will be wonderful for you. Sit down like this in the ground, comfortably. I want to see. Let everybody put their video on. And Sri, you monitor them on a gallery view. From here, see if you can get up without support. Unassisted. Sit down again, opposite, crossing your leg. So you make it fun. He said, if you put one hand to get up, you lose 25% of your life. You put two hands to get up, lose 50% of your life. If you get one foot and one leg, you get 75% of. Initially, it will be difficult, but slowly you'll be able to get up. Next, putting head below your heart. When you put a head below your heart, your pressure in the intracranial pressure goes high up. Pressure inside your brain. Pressure inside the eyes goes high up. Pressure inside the carotid arteries goes high up. You cannot talk, you cannot breathe, you feel miserable. Keep your head down. Slowly. As long as you can. 5 seconds is good. 10 seconds, 15 seconds. Slowly and slowly you'll see your flushing goes away. The breathing becomes normal. What happens, there is an activation called a baroreceptor sensitivity. Body's homeostasis. In fact, we call it a homeokinetics. Body's own healing process starts to come in. Like pressure inside the brain comes down, pressure inside the eye comes down, neck comes down. My body goes high. I get up into a Shishasana, shoulder step. Nobody touches me, nobody does anything. Or you can do a, we call it a Prasharita Uttanasana. And then also one thing you can do, say we do pranayama. I'm not doing all the pranayama practice and other, we'll do it another time, but I will show it to you what are the pranayamas you need for different diseases. You do pranayama only sitting down and maybe in a chair, ground, or laying down. But pranayama is a total relaxation. So what I will do, take a look. I'll put my hand in the back. I do a Vrikasana. I do a tree pose. And when I'm in a tree pose, Vrikasana, I'm doing a Kapalabhati Pranayama. You know, these are treatment. You know, in a diabetes, we do disease by disease next. That is called your reductionist holism. Vajrasana, Mundukasana, Shashankasana, massaging your pancreas. Sit here, keep spreading your leg. Prasharito Uttanasana. Wide spread and supported hand. Slowly put your head down. For us, You can get all the way down, put your head all the way down. But look at, I'm talking, I'm breathing, I'm totally effortless. In fact, I'm so relaxed here, I can do a Kapalabhati Pranayama here. After you finish a set of asanas, you can do a, and I can show it to you a little bit more. And we'll have a little time for question and answer. Let me show you a few more yoga therapy practices before we finish. You have seen a Bhramari Pranayama. Now you can incorporate a Bhramari Pranayama with your practice. Now, say if you can sit down properly, you do a Paschim Namaskar. So let me show you how to do a beautiful Paschim Namaskar. Put your hand here. Wherever your hand comes here, stay here. But if you can put your Namaskar Mudra will come in, and slowly your hand will go high up. Longer and longer you stay. You keep your hands all the way high up and stay here. You know, the most, I don't know if you know this, the lifestyle related disorder, the biggest one today is that software engineers, IT workers, they're hunchback, they're looking in front of that. I tell them, do your Paschim Namaskar. In a Paschim Namaskar, now we do call it Yoga Mudra, or you can do Brahma Mudra, any mudras you can do. Neck, 4 postures. What you will do, you'll incorporate a Bhramari Pranayama with your exhalation. So you are breathing in, suppose first you breathe out. Breathing in, slowly put your neck to the back and breathe out with the sound of a Bhramari Pranayama. This way you extend your exhalation, which is parasympathetic, and take a look. I still have a lot of saliva in my mouth. It's a parasympathetic activation, relaxation response. And doing the side to side, looking all the way to the back, turn your neck. These are all the 4 postures of your Brahma Mudra. Let's do the last one. Turn your neck. So how to do? Breathe out first. Deep breath in. My hand, I'm so relaxed, so comfortable. Then when you can do exhalation longer than inhalation, then you do very rapid Bhastrika Pranayama. Normally what you do Bhastrika, you can do your hands high up, breathe out first, take a deep breath in, and then breathe out. We do a set of Bhastrika Pranayama, Kapalabhati Pranayama, Anulom Vilom Pranayama, then you do a little Bhramari Pranayama, Ujjayi Pranayama, Sitali Pranayama, then Om Pranayama. That's our daily practice. We'll do another session when the time comes with a pranayama, but you will see what a rapid Bhastrika Pranayama does. Rapid Bhastrika Pranayama, what it does, it washes away all the carbon dioxide, brings oxygen in, it creates a hyperventilation syndrome, then it causes aerobic glycolysis. Glucose combines with oxygen, produces carbon dioxide, water, and we call it ATP, called adenosine triphosphate, which is energy. Washes away all the lactic acid, pyruvic acid, pain-producing substances. I'm relaxed with the Hagini Mudra, and I'll be doing a very rapid Bhastrika Pranayama. If you want to do with me, please be welcome. I did 200 of them. I'm totally effortless. I'm breathing, I'm talking, I'm singing. That's what pranayama practices. No effort. We do it morning, jalneti, the water comes out. You do Kapalabhati Pranayama with all the mudras. Dhyana Mudra, Gana Mudra, Vayu Mudra, control your pain, Shunya Mudra, Prithvi Mudra, Varun Mudra, Shakti Mudra, Apna Mudra, Apna Vayu Mudra, Linga Mudra. So what do you do about 20 to 50? Sit down. Do few. Then just to show you, we're running short of time, just to show you how to do it. We'll be doing effortless, 1 per second. And just keep on changing your hands. We'll do another session on the mudras, you will see. Essentially what happens when your body is physically prepared, sthiram sukham asanam, your breath is prepared, effortless breathing, exhalation longer than inhalation, your mind enters into meditation. So you don't practice meditation. Meditation will come to you. Dhyan comes when you can elicit arambha, sthiti, and visarjan. When you come to the visarjan, dhyan comes to you. And you will see when the dhyan comes to you, you will be able to do your alternate nostril breathing, Anulom Vilom, without closing the nostril. We'll finish with that practice. It'll be a wonderful session. And you always practice Ujjayi Pranayama, all Om Pranayama. You can do this and we'll do another session. But before that, a couple of you want to sit, and I also want to show. These are called show off asanas. You have to show off that what a practice will bring it to you. People talks about Shishasana, Sarvangasana. Let's do a Mayurasana. See how many it can do with me. Mayurasana. Put your hands here, bend your elbows, put your body on the elbows, body goes in the front, and the whole body goes up, stays. Mayurasana. You know, many of you know, I think Shri knows, and Vinod also knows, I had open heart surgery 20 years back. Last 15 years, I don't touch a single pill. I'm medication-free, disease-free. Every year I go for a, you call myocardial perfusion scan, everything is normal. Because then in the animal world, women are more powerful, Mayuri In a Mayuri you get into a Padmasana, Forget Padmasana, you do Mayurasana. But what you notice is, I'm talking, I'm breathing, my Annomaya Kosha and Pranomaya Kosha is in sync. Anulom Vilom Pranayam, alternate nostril breathing. Left nostril is controlled by the right brain. Right brain is intuitive. Right brain is female. Right brain is cooling. Left nostril breathing is called your Chandranadi, moon energy. Right nostril is controlled by the left brain. Left brain is analytical, male, heating. Right nostril is Suranadi, sun energy. Sympathetic, parasympathetic. So the way to do it, bring the balance. It balances the both sides of the brain. Wonderful practice for dementia. Wonderful practice for Alzheimer's disease, hypertension, balancing both sides of the body. We lose our memory, we call it dementia. We lose our focus. We lose our activation of other side of the brain. Left hand do a Dhyana Mudra or a Jnana Mudra. Right hand, close your right nostril. You don't have to close all the way down, just below your nostril. Breathe out through your left nostril. Breathe in through the left nostril. Close your left nostril with a ring finger and little finger. Breathe out through right nostril. Bring in through your right nostril. Bring out through left nostril. Do it exhalation longer than inhalation. You will always see your one nostril is more open than the other. It's Ida and Pingala. In alternate nostril breathing, your Shushumna Nadi opens up. Next you practice as long as you can. In a daily practice, we do 1 hour, 25 minutes of asanas, 25 minutes of pranayama, 10 minutes of meditation. Next, you put an index finger and middle finger on your in between eyebrows and the third eye. Close your eyes, bring your focus into your third eye. Then use a super brain yoga. Use your left hand, hold on to your right earlobe. And then you do alternate nostril breathing. You have no idea, within a short time, you will be in a transcendental state. You have no idea where you are. You will be entering in the total sense of meditation. These are meditative practices, balancing both sides of the brain. And this meditative practice will last with you throughout the whole day. And then to be properly correct, you do the other hand. It's a wonderful experience. Now you can do with your left hand, you can left hand, and the right hand you hold into left earlobe, focusing it and keep doing your alternate nostril breathing. Ujjayi Pranayam is an excellent pranayam. You can do Ujjayi Pranayam and you can do Jalandhar Bandha. Jalandhar Bandha is bringing the chin down to your chest. It activates your carotid sinuses. Then you do your left nostril breathing. Totally, Ujjayi Pranayam is activation of vagus nerve. It's very good for your snoring, very good for your sleep apnea. So the way to do it is that, let me show you one time so you'll understand what I'm talking about. Breathe out first. I do all with my eyes closed. Deep breath in. Completely breathe out. It is so relaxing, it even activates your Uddiyani Bandh, abdominal lock, Jalandhar Bandh, and Chandravedi Pranayama. All parasympathetic activation. Let's finish with a meditative Anulom Vilom Pranayama without closing your nostril and guidance through your breath. Just a couple of minutes, then we'll have about 5-10 minutes for a question answer. I'd like you to put it in the chat, and Sri, you can read that for me, or you can go into the gallery mode and we'll talk about it. Keep your spine straight, eyes closed, touch your index finger and thumb. First, visualize your breath. Visualize your breath is coming in through your nostril. The nose is a filter. Your air is getting filtered. Nose is your personal air conditioner. Outside air is warm, it is cooling it down. Outside what is cold is warming it up. Air is going to the side of the nostril called a turbinate. Turbinate, there is a developing a jet effect, vortex, vibrating the mucus of your sinuses, secreting nitric oxide. Nitric oxide is a powerful vasodilator. Nitric oxide is a mediator of your parasympathetic tone. Acetylcholine, cyclic GMP, nitric oxide is a mediator of your parasympathetic tone. Breath is coming behind your throat, upper part of the lung, middle part of the lung, lower part of the lung, level of your belly button, which is cable kumbhak. Stay there for a while. Visualize your breath coming from lower part of the lung, middle part of the lung, upper part of the lung, behind your throat, coming out through your nostril. Breath is the carrier of prana. Prana is a subtle energy, keeps us awake, alert, and alive. Breath is not the prana. Breath is a carrier of prana. Breath is like electric cable and prana is like electricity. For yoga, the prana goes to everywhere. Our whole body does breathing. Visualize the breath is picking up prana. Prana is coming through your nose inside your body. Then the prana is going to the organ of healing. For me, prana is going to my heart. I'm having a healing of my heart, pranic healing. You have a back pain, you visualize prana is going to your back, causing the healing of your back. You have a diabetes, visualize prana is coming through your diabetes or for your pancreas. It's a wonderful pranic healing. Then in silence, practice alternate nostril breathing without closing your nostril. Initially, it looks almost impossible, but is entirely doable. Visualize your breathing out through your left nostril. Breathe in through your left nostril. Breathe out through your right nostril. Breathe in through your right nostril. Then in silence, you keep on doing few cycles. And because of the lack of time, I'll give you a signal when to finish, and then we'll finish with this practice. This is a practice to do longer at home. Now slowly bring your hands in front of you, touch your little finger and thumb, then separate your ring finger, middle finger, and index finger. This is called a Padma Mudra. Padma Mudra unites your body, mind, and spirit. Slowly bring your hand close to your heart. Heart is the site of your soul. And we tell all the time, memorize by heart. Heart and brain is connected. A practice of yoga therapy gives us a well-being. It's a wellness. It's a physical, mental, spiritual health which is in a balance, unlocking the power of medicine cabinet of my mind. All the medicine comes from mind. Slowly bring your hand in front of your heart chakra, bow your head down, say namaste. I honor the divinity within you. And again, finish with another palming and cupping. Rub your hands, rub your hands. When you feel the warmth of your hands, if you're wearing glasses, remove your glasses, take the hands like a cup, put it over the cup. Massage your forehead, massage your eyes, massage your face, massage your ear in the back, in the front, external ear canals, activation of your auricular branch of the vagus nerve. Massage in the front, activation of your carotid sinuses, massage in the back. It's a wonderful practice. Thank you. I have a few more minutes for question and answer. Or if you want to stay a few minutes, it's fine. I'm going to finish here now. And Shri, you might take me off from your spotlight view so people can come to your gallery view. If they ask any question or if they have any question, I cannot read it from here. So if you can read it for me, I'll be able to let you answer.
So I have removed the spotlight. Okay.
Yes.
That was a wonderful, mesmerizing session, Dilip ji. Really nice. There are a few questions. Let me just read it from the chat box.
Okay.
The first one is, provide the name of the chair with the wheels once again, the one that you had, the chair.
These days, you need only one name. It's called Amazon.com. You've heard of Amazon.com? It's a type called a kneeling chair. Knee, like a kneeling chair.
Okay, not the
And
kneel chair. Okay.
Kneeling chair, and it comes in all different forms. I have it for years and years. This may be my fourth one. And this is actually in front of my computer.
Okay.
The hunchback is the #1 disease what we have. Yeah, Amazon.com, kneeling chair.
Okay. The next, Dilip Thatte wants to know what pranayam would you recommend for addressing pulmonary fibrosis?
Actually, pulmonary fibrosis, what we do, that remember, when you have a problem in breathing, you develop a fear, panic, and anxiety. So we really don't recommend to start with any of your pranayama practice. What we do is start relaxation response first. Start relaxing your respiratory muscles. Do the shoulder, it is called the Skandha Chalanasana. Do your Brahma Mudra. Do your Paschim Namaskar. When you're able to do that, remember in pulmonary fibrosis, you are not into exchanging. So what you do, you breathe out first, then you take a deep breath in, breathe out a little longer time, then slowly and slowly you incorporate what is called a breath holding in inhalation, breath holding in exhalation. It is called a Savitri Pranayama. But remember, don't try to do a pranayama first if you have a respiratory problem. The reason is, when you have an Annamaya kosha, I have a problem in my lung, fibrosis asthma, it affects my pranamaya kosha. I cannot breathe properly. When I cannot breathe properly, it affects my mind, manomaya kosha. I'm anxious, I'm panicky. I'm not going to do the breathing if you tell me. So I need to prepare my physical body first. Then in the typical Savitri Pranayama, what we do, first, take a slowly deep breath in. This is called Puroka. Then you hold your breath. It is called Abhantarin Kumbha. Hold it as long as you can without any effort. Please don't make any effort. To make an effort, it is not a therapeutic pranayama. Then you exhale out. It's called Rechak. Then you hold your breath again in Rechak. People ask me how long, what number, 4 second in, 8 second hold, 8 second out, 4 second. Those numbers are arbitrary numbers. It varies from person to person. But my way approach to you is that totally effortless ease practice. As long as you can do the practice with your talking, breathing. And when you learn how to do this, your breath holding in inhalation, Abhantarin Kumbha, in Abhantarin Kumbha, you incorporate Jalandhar Bandha. It is called a Murcha Pranayama. A Murcha Pranayama is a wonderful practice for pulmonary fibrosis. It even puts you totally mind quiets down, fear goes away. Let me show you one technique, a Murcha Pranayama. First, you breathe out first. Take a deep breath in. Hold your breath. And keep your neck straight. Slowly drop your chin down. Touch your chin close to your chest. And you stay here. Keep counting as long as you can stay here. Remember Murcha. Murcha is called unconscious. Keep doing it. But again, please prepare your physical body first before you get into a pranayama practice.
Thank you very much.
Welcome. Call me. I need to talk to you. Okay.
The next one is, I think you answered it, but how long and how many cycles we should do pranayama?
Actually, again, like for us, we say we do a daily practice, 25 minutes of asanas, 25 minutes of pranayamas, 10 minutes of meditation. That is my and our usual practice. Asanas, we rotate the asanas, but pranayama, we do fixed pranayama. We do a start with the Bastrika, we'll do, and then Kapalabhati, then Anulom Vilom Pranayam, then we do a Brahmari Pranayam, Ujjayi Pranayam, then you do little, another called Shankha Pranayam. Shankha Pranayam is a resisting exhalation. It's wonderful. You do it's called Hagini Mudra, put one in the top. You breathe out first. Remember, you do not use your mouth. Say, always breathe through your nostril. If you breathe through your mouth, you don't know what the air has gone in. But you can use your mouth to use like for Sitali Pranayam, cooling down, or blow it out like the Shankha Pranayam. Breathe out first. Take a deep breath in through your nostril and breathe out. So we do a set of pranayama, but I say people say do it 5 minutes, 10 minutes. I say start with your body will allow. At the beginning, you may do 30 seconds, 1 minute. Why? It happened to all of us. We could not do anything. I was a surgeon, I was operating, bending over. I had a serious back pain, neck pain, could not breathe, I can do everything done. So 25 minutes asanas, 25 minutes pranayamas, 10 minutes of meditation is a very good practice for daily.
Can I ask you a question?
Sure.
Just one thing, there's a few more things in the chat box. And I just want to mention that all this thing is getting recorded, so you don't need to just jot down exactly what he's talking about.
I have time. If you guys have the time, I'll be glad to answer because I like to connect with all of you.
Sure.
We have some session going on next.
There are a few other questions. One is about ear issues. So ear infection, do you recommend any kind of pranayama that's good for ear pain or ear infection?
Ear pain, actually for the ear and tinnitus, we call it a Karnarogantar Pranayam. Karnarogantar Pranayam, we call it your Valsalva. So basically, we have an ear connected through your eustachian tube. Opens the mouth. So blockage in the eustachian tube is one of the root cause for the miliary infection and ear infection. So what we'll be doing, we'll be breathing out first, taking a deep breath in, and trying to blow out with closing our nostril and mouth.
Oh yeah,
and you will see both the eustachian tube will open up. Or you can do a swallow. And you do it all the time when you're in the plane, when the plane is trying to land. Your ear gets blocked because there's a tube connecting from the ear comes to your mouth. It's called a eustachian tube. Take a look at it, Google it. You'll see all of them. So you open up. The pranayama is called the Karno Rogantar Pranayama. Karno is a ear. Rogantar means treatment. It's a pranayama. And in Western medicine, we call it a Valsalva maneuver.
Dada, can I ask a question?
Sure.
Yeah, sure, go ahead.
During our gold nugget process, we breathe out and hold the breath for 40 seconds. But I cannot go more than 25 seconds. I cannot hold the breath out for more than 25 seconds.
You didn't hear me the whole session? What the whole session I was talking to you?
Yeah.
Huh? What the whole session I was talking to you? Listen to your body. Why do you have to hold 25 seconds?
Okay.
Hold for 5 seconds. What your body will allow you today to do it. But if you keep on doing it, this is called a neuroplasticity. You will get into 5, 10 seconds, 15 seconds. One day you will see you'll be able to hold it for as long as you want. Do not put in a time frame. Do not compete against anybody. You do, even in my class, I don't know if you might have seen, I tell everybody, do it with your eyes closed. So you don't see even who is doing what. When you do eyes closed, yoga is a introspection, looking inside yourself. We said, exercise is a workout. Yoga is a work in. So listen to your body's signal. Don't fight against you to do a practice.
Does it indicate that your lung capacity, or it is a processing the carbon monoxide?
It doesn't indicate anything. It indicates that you are not listening to your body. It indicates a lot of things physiologically. But what it indicates that you are in a state that you listening to your body's signal. I can do this much. Yes, more carbon dioxide. We have explanation for everything. We are scientists, we're a physician. But our only explanation and guide to you is that introspection, self-realization, listening to your body, listening to your soul, and progress accordingly.
Thank you.
Welcome.
Can I have one question, please?
Sure.
I have a diabetes type 1. What kind of pranayama can help?
Okay. First of all, you've got a diabetes, the type 1. Type 1 diabetes in yoga talks about imbalance in your physical body. You do all the balancing asanas. Balancing asanas followed by, if you want to do a pranayama, you do alternate nostril breathing, Anulom Vilom Pranayama. And then finally, what you need to do is remember diabetes today, if you know this there, he knows that if you put a person a little bit of prednisone, the blood sugar goes up. Prednisone is called a steroid. Steroid increases the blood sugar. And the hormone of stress is called cortisol. The stress increases the blood sugar. But massaging the pancreas, Kapalabhati Pranayama. We do Kapalabhati Pranayama and we do what is called your Prithvi Mudra. Prithvi Mudra is touching your ring finger and thumb. It really stabilizes your obesity, truncal obesity, and the most important cause of diabetes is called truncal obesity. So you sit down in a Prithvi Mudra, close your eyes, very gently and slowly do Kapalabhati Pranayama. To do alternate nostril breathing, Anulom Vilom Pranayama, but before that we do all the balancing asanas.
So one thing I wanted to mention, the question that who asked Nayan, he has excellent headstand. Okay, so he does balance the other way.
See the headstand. So see, people all ask me about headstand. Okay, so think about a headstand. You don't do a headstand. Okay, so so even for your teachers, how to learn a headstand. Headstand is the most relaxing asana. If you look at yoga practitioner, say, who can you say? Say Iyengar. One thing, let me tell you. All our present day yoga gurus or practitioners, if you look at, say your Krishnamacharya tradition, Iyengar lived up to 96. His student Pattabhai Joyce lived up to 93. Student Indira Devi lived up to 102. So we have a train, you know. So what you do is sit down in a Vajrasana. Why Vajrasana? Vajrasana is the most relaxing asanas. So then what you do, this is your stance, you put it here, clasp your hand, put your head down, and you feel miserable. Your head is all flush, cannot talk, you cannot breathe. But one thing is that don't let anybody touch you. One thing very important in yoga therapy is that don't do any adjustment. You can show it to them. This is the way you do Vajrasana. They cannot do it today. They can put a little, you know, a folded blanket, pillow, slowly and slowly they can remove. So you are sitting here. Slowly and slowly your breath will normalize. When your breath is normal, flushing is gone, you get up. When you keep on walking, you will see your body goes higher. So you don't have to do anything. Body goes higher, here, come down. But don't let anybody touch you. Keep doing it. What will happen by the time you keep on doing it and keep on walking here, your body is going to go high up. Slowly and slowly is going to go high up. Again goes high up, come down. See, this is the art of yoga therapy. Art of yoga therapy is not to push yourself, listening to your body's signal and progress accordingly.
Can
No.
I used to do Shirshasana in my 50s. I'm now 80. Is it okay at 80 to try Shirshasana?
Why not?
I'm just asking the question.
I'm just asking you. Why are you asking me?
No, I'm
whom do you need to ask?
Yeah.
The doctor within you. You have a doctor inside you. Huh?
Yes.
Don't
Yes.
ask a doctor. Ask
Okay.
what you need. You put your head down. See how you feel.
Okay.
You feel miserable with your head down. Don't do it.
Okay.
Your doctor is saying that you are not ready.
about the
Same thing.
Okay, there is
What is the neck?
like
You know, I tell you one thing.
twist your neck or something, you know.
Oh, you'll break your neck, so don't do it.
according
I
to
can tell you one thing. If you do in stages, 80 years, 90 years, my father-in-law is 97. He does every day. My mother-in-law, actually, they were 84, she's about 86. They teaches yoga even at this age. Every day they're doing it. Any asanas, they can do it. Because you know, your neck pain is not your spinal stenosis, or it is your irritation of a nerve, tightness of the muscle. And headstand is the most relaxing. You know what? If your body is not ready,
Don't do
body
it.
is not going to allow you to a headstand.
Don't do it.
No, it's very important of a yoga therapy standpoint is that listening to your body, don't listen to anybody else.
Thank you.
according to
Very
the
good to
Try that and let me know in a month. You'll be able to
Yes.
do it.
Yes, I will. Thank
Eight
you.
is
One
a
question.
number.
Can I ask a question?
Sure.
Yeah. Okay. Okay. My question is that I normally have clogged nose, because of deviated septum. So I have a problem doing pranayam to start with, and stuff like lom anulom. So how do I proceed? Because I cannot do it completely to start with, and because I don't do it, it doesn't get better. What do you suggest? How should I address it?
First of all, in our morning practice, we do every single day Jalneti. You wake up in the morning, I drink a glass of water, I have a first bowel movement, I brush my teeth, scrape my tongue, I do Jalneti. I took a little powder, and Jalneti is a daily routine. You wash your face, wash your eyes, wash your everything. And this is the most important organ which you are breathing. Deviated septum has nothing to do. Once you do a Jalneti, if you put a Jalneti, first of all, no water will come out. because you are very tight. You are really not letting once relaxation sets in, you'll see when you blow it out, you'll see all the junk and dirt comes up. When you go to India, when I go to India, I do that, literally the black carbon comes up. Then what you do after that practice, you do a little bit of a Kapalabhati Pranayama first. Sit down, I do different posture. Put your head down. Then you close one nostril into Kapalabhati Pranayama. See, your one nostril is open. To the other nostril and then to Kapalabhati Pranayama. See, my both are equal. Now you try on your nose. See, your one side will be less open than the other. But once you're practicing it, then you do the relaxation. See, my both nostril is equally open. Then you'll be able to do alternate nostril breathing. And it's a comforting. Only thing you need to know, it is a slow process. It's not going to take overnight. So you have to keep working on it and listening to your body's signal.
So Jayant, go ahead if you want to ask a question.
Yeah, Sriji, I have a question after.
Sure.
Hello, I am actually like a 25-year-old male, and I came over to US for my master's degree. I completed my master's degree, just started my job, and I was diagnosed with multiple sclerosis. I have lost vision in my right eye, and after an MRI of my brain, neck, and spine, they told like I have some lesions or white spots. So basically, my nerve endings has a bilirubin fat which is being scraped off by my own immune system. So it's an autoimmune disease. I'm trying to do some yoga from the last 4 to 5 days, but I'm not able to take up very strong ones. Like I cannot do the headstand or any, or any type of yoga that is really is very strenuous, because I have this weakness and fatigue factor also kicking in. So do you recommend any specific yoga, Guruji?
Sure. First of all, you remember multiple sclerosis, you're losing the covering of your nerve. So like, you have electric cable. It has a coating. The nerve coatings are gone, and it is primarily called an autoimmune disease. Like our body is fighting against. Autoimmune called is an imbalance of your immune system. Your immune system. So you bring all the balancing poses. And remember, yoga as a therapy is a relaxation response. It's an activation of parasympathetic tone. It is not doing any strenuous, not doing the headstand, not doing your Mayurasana. It will all come to you. You practice a very slowly graded balancing asanas. Try to standing on one foot. Do your hands, do your Gomukhasana. And anytime you use your both side of your hand and then do the pranayama, very slow, methodical pranayama. And remember one thing, the whole yoga therapy practice is called your anti-aging. The whole multiple sclerosis is basically your body is acting up, eating up because of imbalance. And yoga therapy brings the balance back in your body and mind. You can go to my website, or you can go to my YouTube channel. Sri, you can share my YouTube channel. Go to Dilip Sarkar Yoga and share with all of your people. And I have all the yoga therapy for all the neurodegenerative disorders, multiple sclerosis, diabetes, every disease you have. I have the videos over there. And I have one video which is called Yoga Therapy for, this is the one. I have the book. The book I wrote is called Yoga Therapy, Ayurveda and Western Medicine, A Healthy Convergence. You can get my book. The book has all the, then I have a DVD. It's called Yoga Therapy for Health and Healing.
Okay.
So do not force yourself. Listen to your body and do a daily practice. You will overcome it. You will overcome what you have.
Jagdish, you have a question?
Yeah. Can I go?
Yeah.
Sure.
Oh, okay. Yeah.
After
Dilip
that, I
ji.
have a question, Sriji.
Okay. So go ahead, Jagdish.
Okay. Yeah, Dr. Sarkar, thank you for the wonderful session. I have attended one of your sessions at the Siva Vishnu temple 3 years ago. And I had that book also. So anyway, a quick question is two questions. One is about acid reflux. So I've been taking acid reflux medication for like about 8 years. So I really actually want to get off it. So which are the asanas and which are the pranayams are specifically will helpful? And the second one is about Siddhasan. I can do a really good Siddhasan, but because of the acid reflux, should I avoid doing it at a certain time or after eating certain food? Can you be specific about it?
So you guys are like a Western people thinking, staying in America become Western. I want all the shortcuts. I want to do a shortcut for acid reflux or a shortcut. Acid reflux is basically you're producing more acids because your mind is hyperactive. You know, your software is working too hard. So do all the calming, cooling practices. And if you want to specifically go is to the Sitali Pranayama. Sitali Pranayama, Sitkari Pranayama, and acid reflux is also called a Pitta disorder. And we do the asanas is called a belly centered. Any asanas which is centered to your belly, and also do your abdomen relaxing asanas. Kapalabhati Pranayama, you can do a Mandukasana. Mandukasana is a wonderful asana. You sit down in a Vajrasana. With a Vajrasana, you put your hand there, pushing, and then keep coming down, to the head down. Vajrasana, Shashankasana. Then you do your, we call it a Petanaram, Shir Thanda, Maro Daktar Ko Danda. समझा हाँ मेरा हिंदी तो बहुत अच्छा हिंदी है I cannot speak Hindi but Petanaram, your abdomen has to be softer. So that is the way you call it your Udyani Bandh, Agnisar Kriya. And regarding headstand, people all ask me, I have a neck pain, I have a head pain. My doctor has another thing, very important thing. If you really want to do a headstand, if you want to do it in privately, especially in our age, and don't talk to your doctor. Because your doctor has no understanding, and doctor will scare the hell out of you. And I tell you one very beautiful example. There's a lady, she was practicing. She was in my class. She got really got my, into. Her husband told her not to. She said, why? He said, their health insurance premium will go high up. So coming back for the acid reflux, you do a Sitali Pranayama. And all the asanas to do your Petanaram.
Thank you. Excellent. Yeah. Very, very specific. Thank you.
Daily practice. Remember, only way you will get out of any disease is a daily practice. No shortcut.
Can I ask you a question, Sriji?
Raviji is first, and then after that you can ask Bula.
Sure.
So Dr. Sir, my question is regarding hypertension. I'm taking about 6 medications just for blood pressure. So is there something specifically you can recommend to bring it down?
Yeah, today we strongly believe that hypertension, unless there's a cause, is your own creation. You have created your hypertension. And primarily the hypertension causes the tightness of the blood vessels. It's called a peripheral resistance, and a relaxation response, and a pranayama, a very relaxing pranayama. And incorporating your daily lifestyle. See, a simple yogic lifestyle. Wake up in the morning between 4 to 6. We call it a Brahma Muhurta. Sit down in a squatting pose, drink a glass of water, had a bowel movement. We do a brushing out teeth, scrape out tongue, gel neti, do a little late breakfast, In yoga, main meal is a lunch. If you go to India, you see the yogis. Lunchtime, what they eat? They eat a little bit of khichdi. The problem people ask me about diet, what diet? You know what the biggest problem with us is diet? We eat too much. Main meal has to be lunch. Then you do a little bit of afternoon, go to our bed a little early before going to bed, a glass of water, have a good night's sleep. You will see your blood pressure will start to come down. Alternate nostril breathing, Untitled Pranayama, is the therapy for hypertension. And the relaxation response is called a reduction in the afterload. The physicians here, they will understand. It reduces called peripheral resistance. So for hypertension, what I will do, I'll be doing all very gentle relaxing your hands, relaxing your Paschim Namaskar, relaxing your neck, relaxing your back muscles, and do a fine, very slow alternate nostril breathing. But these are in addition to your daily practice. If you keep on doing just specific few things for one disease, what I have seen in my practice, your disease gets worse because your mind, I'm not getting anything. Oh, I'm doing Kapalabhati Pranayama, blood sugar is going higher. You're not doing it too fast, too rapidly. You are not listening to your body signal. I like to listen to Bula. I see Bula's one. Bula, go,
Bula,
Bula.
go ahead, Bula.
Where is Bula?
Hi.
Can you put the video on? Yeah, okay.
Yes.
Yeah,
Yes.
all right.
How
Let's
are
see her.
you?
Come on,
Yeah. Yeah, you are the one who introduced me to this yoga class from Rajnarayan class, then Sriji, I have been following all of you. So here is my question. In short, I have TKR, which is, total knee replacement. And I always get scared of sitting you said Malmutra? That one. Malasan. So is there any alternative to of this to your book or something, somewhere?
It's not, you see, knee joint replacement, hip joint replacement, these are all, you have a scar tissue, tightness. So I have people in my class with a knee joint. I have one from Mrs. Kapoor. She sits down. So what you do, you have if you cannot sit down here, you come down, sit wherever you can.
Yes.
You stay here.
Okay.
Chair,
okay.
Get a chair at hand, you sit down here, stay here. Then you get another lower one. You get a lower one, you come down slowly, more come down. In stages, you will see slowly and slowly you come down. So we really have no restriction for you. You practice without taking any pain medication.
Right.
And practice not go up to the pain. If you stay behind your pain, and if you go in stages, like I have this knee joint is more swollen than this. I have a lot of changes, but nothing. This is
just gradually you go.
Gradually you do it, and a total knee joint, total hip joint does not restrict us from any kind of yoga process if you're listening to your body's signal and you are doing it without taking any pain medication.
Yeah, I don't take the pain medication, and the way I handle this one, like you said, copper glass, I've been drinking water early in the morning in the copper glass, I try to do it, and it's been a year. But the way I handle this particular asana, I take that water when I am on the commode.
That's okay.
Is that okay? Or
yeah, this is okay, but remember one thing: the whole yoga practice is let go.
Let go.
The whole yoga practice is that I want to do it, you will never be able to do it.
Okay.
Only way you'll be able to do it, you said, you know what? That's it. I don't want it. You listen to your body, and this is basically called, Shri knows very well. It is called let go phenomena. The moment you start let go, everything happens to your body and mind. The moment you want something, remember in our scriptures, the nishkam karma, your karma has to be nishkam. The moment you have a desire, the moment you have an outcome, everything falls apart. No outcome, no desire.
Thank you so much. It's a wonderful session. Thank you.
Answer Suno, Sri. Let's finish with the roll call. Karo Yog, Raho Nirog. Huh?
Okay.
Karo Yog, Raho Nirog. Okay? Everything okay?
Yes.
Anything else is waiting? Anything?
One last question.
Okay.
According to the ophthalmologist, headstanding is not good for your eye pressure. Is it?
When do you talk to your ophthalmologist?
I don't want to name it, but
Yes.
Why do you talk to your ophthalmologist? You know who you need to talk to? Your own doctor. Did you talk to your own doctor? You put your head down, see how you feel. You feel your eyes are throbbing, eyes are bursting. Don't do it.
Don't do it.
no, I keep doing it. I do it all the time. But
So
just
listen to the doctor inside you. If your doctor inside you says, you know, I'm a Western trained doctor, I can tell you. Western trained doctor works with only one principle and phenomena. It is called a fear factor. It will scare the hell out of you. So you keep coming back to them. Listening to your body's signal, you have the only healing power, and you will heal by yourself.
Thank you. Very nice session.
Excellent. Excellent.
That's very wonderful session to Dilip ji, and really appreciate you spending time with us. And we'll certainly.
Where does he stay? Where does he live?
You know, I tell you one thing, the most important thing what I've done for you and what I do for everybody, I'm not scripted, and I'm doing it from my own personal experience. I do it every single day. I'm sharing my practice, and I'm sharing based on what you are exchanging with me.
From which town you are in, sir?
In Virginia.
In Virginia, okay.
Norfolk, Virginia, not too far from you guys, you know.
Okay, not far, yeah.
My son and daughter lives in DC, so I come there all the time. After pandemic, Shri might have a session, we'll come to a session for you.
Good.
Is there
And
a
then
way
put us in the home, you know.
Dr.
Age is not a factor at all. You know, remember one thing. You know, it's your mental age. It's not your physical, it's not chronological age. I've seen people, you have seen people in 50s that already looks like 80s and 90s, and people in 90s, 97. The only thing is he cannot hear much, and he tells me, you know, it is so blessings for me. I don't have to listen to all these problems in the world. I'm fine. You know. Wonderful life, you know.
Can I ask one question?
Yeah, go ahead.
I broke my my arm, and I had a surgery and inserted a metal piece here, and I feel my bolts and nuts here and there, and but I have a pain, not here. I have a pain. Metal pieces here, but I have a pain here. And when I consulted my surgeon, and he said if even removing this metal piece doesn't relate with your pain there, so well, you can avoid another surgery if you just leave the metal piece. But when I talked with the acupuncturist, he said, without removing the metal piece, we can treat you. So I'm just stuck. Can I ask your?
Sure. Best way to do it, you try to find a position where it hurts. Okay, this is causing pain, so you cause less short of pain, and then in that position you do alternate nostril breathing. So when you do alternate nostril breathing, it brings the balance back, and you will see by the time you close your eyes to alternate nostril breathing, your hands will go back here, and you will never know hand has gone there. It's a wonderful practice. You try this. You know, this area it hurts, go short of it. Close your eyes, do alternate nostril breathing, and just pay attention to your breath. Don't pay attention here. I have so many times people have a frozen shoulder. So I said, go to Kapalabhati Pranayama. Oh, I cannot raise my arm. It's okay. Close your eyes, do it with one hand. When they close it with the one hand, suddenly the other hand goes there. Because your mind goes into your breathing, and that is called your koshas, Annamaya kosha to Pranamaya kosha. When you pay attention to your breath, your physical body goes up without knowing.
Yeah.
It's a wonderful practice.
Just wanted to mention that the person that asked the question, Kate, 1 year ago, she didn't know anything about yoga. She's, during COVID, she started attending classes, and now she's a certified yoga teacher, and she has excellent classes.
Beautiful. But ask her to incorporate the pranayama and asana together for therapeutic purposes.
Thank you very much.
Welcome.
All the credit goes to Shri. Thank you very much.
Thank you.
Yeah.
All this.
Thank you.
He has.
That was great.
I can,
Thank you.
I'm talking. I don't know I'm talking. I'm effortless, so I can continue for a whole day.
Dr. Sarkar, is there a way to connect with you on the phone in person for
No.
some serious physical conditions?
I think you heard me what I'm saying, and you do it yourself. Yeah, you can always call me, talk to me, but and that is not going to help you. What will help you?
Yes, Dilip Parikh, just please mute yourself.
Is
sorry.
listening to your body and do a very gentle practice.
Right.
Don't push yourself.
Yeah.
Dr. Sarkar, I have a
Thank you.
question. Some people tend to sleep with their mouth open. You said it's always good to breathe through the nose rather than
Generally, what you do in yoga practice, what you say when you have a mouth open, that means your nostrils are blocked, And in yoga, it says when you put a oleation in the nostril, your nose opens up, you don't have mouth breathing. Mouth breathing is dangerous. Mouth breathing is a sign of your sleep apnea, a sign of your snoring. So what I do, what we do before going to bed, take a little oil, and we use in a very private practice. We do on a little finger. We put the oil inside our nostril, oleate everything, because at night what happens is the dryness, the mucus dries up, and your nostril gets blocked. We say we sleep through our nose, not through our mouth. I don't know, I'm from Bengal. In Bengal, we say one word, Bula might hear it, called naak tel diye ghumai. We sleep with the oil in your nose. So oiling the nose is a better. Bula naake tel diye ghumai. Sunecho?
হ্যাঁ শুনেছি
সেই জন্য নাকে তেল দিয়ে ঘুমায়।
আর ওয়ান মোর আর একটা কথা বলছি আমার যে ডাক্তার প্রাইমারি কেয়ার ফিজিশিয়ান 44 years old, she always advised me to do yoga twice a day. Maybe your student, I don't know.
I think a lot of physicians are now realizing that this effect of this relaxation response has a profound effect on our chronic diseases, chronic lifestyle-related diseases.
Yeah, it's all good. I mean, I really love my doctor.
No. You have to love your own doctor. You have to love your own doctor.
Oh yes, that is the first one. This one is second one. Thank you. Good seeing you.
That's it now. Okay. We'll socialize next time we come together. Shri, if you want to this.
Thank you very much, Dilip, and I'm going to end the meeting.
Thank you, Dr. Sarkar.
Thank you.
Thank you so much.
So let's do it again.
Thank you so much. Very nice. Very nice.
Meditation. All right.
Thank you.
Bye. Thank you.
Thank you.
Thank you very much.
Thank you very much.
Yeah, excellent session.
Yeah.
Thank you, Doctor. Dr. Sarkar, thank you very much. Thank you.
Take care, Ramesh.
Thank you, sir. Thank you.
You, sir, also.
I have been your student for 25 years now.
Shrikant, wonderful.
I am my student for all my life,
Starting with Life in Yoga Foundation, we are still connected.
Sure.
All right. Thank you, sir. Bye-bye.
I can't thank Sri Guruji enough. Thank you, Guruji.
Shri, thank you.
Thank
you, Shri.
Everybody stand up without any support.
Yes, get up without a support.
Yes.
Good. Wonderful.
I did
man.
it. Thanks, sir, for bringing such a wonderful program. Thank you.
Welcome, Savita. Namaste.
Thank you. Thank you, Guruji.
Thank
Hi, namaste. Hello, Preeti. Namaste.
you, Shri. Very nice program. Thank you, Sarkar ji. बहुत अच्छा किया आपने. Yeah, so many questions has been solved. So I have one question for you, if you don't mind.
Go ahead.
Is there any suggestions for you, the patients who is having RA problems?
Very simple. Relaxation. Everything comes from the tightness. To the relaxation practices. Don't push yourself to relaxation asanas.
Okay. Thank you.
Welcome.
Dr. Sarkar, I have one question.
Yes.
So you spoke about yogis not wearing reading glasses, right? So though I got my very minor reading number about 5 years ago, and I tried to kind of maintain it for a couple of years. And I started my yogic practices mainly with the pranayama and light warm-up about 5 years ago. But I still have reading glasses. It's not going away.
It will never go away because your mind wants to get the glasses away. That's why you are wearing glasses, no? Nishkam karma. Do the tratak and eye movement. Take your eyes, take a look at the eyes, do the eye exercises.
I
It's
do
called
that.
Tratak. Do a tratak daily. You'll see a lot of improvement in the eye.
Yeah, I do the rolling of the eyes, and I take my right thumb in front of me, and but I don't do tratak in true sense, like, looking at the jyoti or something. So,
but keep doing it. But only thing you need to do, get your mind out of the way that I don't need the glasses, because that is driving you to the point. Like, I don't wear any glasses,
Haji.
But for me, yes, if I wear a little glass, I see better. Okay? But I can leave.
नहीं, मेरा नंबर बढ़ते जा रहा है, इसलिए मैं पूछ रही हूँ कि नंबर every year it goes up. I also know little bit of acupressure for the eyes, और वो जो तुम्हारे eyes के side में जो nerves है ना, उसको थोड़ा stimulate करो, muscles को, वो सब करती हूँ, लेकिन नंबर कहीं नहीं जा रहा.
Number will go higher because you want it. Let go. Let go. Keep doing it. Let go. It will happen to you. It will happen to you.
But in a once a year when you do the eye exam, you feel that it must have at least controlled it. Like same number रहेगा, ऊपर नहीं जाएगा, but वो ऊपर जाता रहता है. So I was like, that question came up.
धीरे-धीरे it will go up more.
Achha, I have one more question. I think you spoke about therapeutic yoga today. Somehow I feel that Ayurvedic massages and some of the Ayurvedic treatments, they are also yogic sciences, So how can we integrate these yogic science, I mean the Ayurvedic medication with the allopathy, which is highly important right now to get rid of the acute symptoms?
It's very simple. See, Ayurveda and yoga have the same root. It came from Veda. Yoga therapy is Ayurveda. Yoga therapy is Ayurveda, and we incorporate every Ayurvedic principle. Next time we'll do it called Ayurvedic yoga therapy. You'll see, you all talk about Ayurveda because you are in the United States. If you're in India, nobody talks about Ayurveda, nobody talks about yoga. It's all same root, same philosophy, same practice. It's just somebody wants to give a different name. And Ayurveda is not those pills, that known herbs. Ayurveda is a philosophy. It's a vat, pit, and kapha. It's your doshas. It's your gunas. So it's your jatar agni. It's your prana. It's your nadis. So these are all part of yoga.
Yeah, but people from India only, they are so much into allopathy, like mainly because allopathy works on the symptoms. It doesn't work on the causal, like the cause of the disease. So they are rushing for the allopathy. And when we say that you should also do Ayurveda, even the Ayurvedic doctors say that you don't go for allopathy. but allopathy it has a faster solution for the symptoms. People tend to go towards allopathy, and then they skip Ayurveda. So what message we should give to such people that we can integrate both the medications together?
You have a very simple message. If you go to India today, you will see that people have failed in all the chronic diseases. So allopathic doctors takes Ayurvedic medication, and Ayurvedic doctor takes, say, your allopathic medication. Remember, pill is not the answer. Answer is your mind. This is your software. If your software fixes your hardware, software releases all the medication. I'm here sitting, I don't take a single pill. I'm healthy. So they want a shortcut. They don't want to do a daily practice. And this is so classic if you go to India, because I go to India so often, I see all this. All the allopathic physicians are taking Ayurvedic medication, and Ayurvedic taking allopathic medication.
No, and they are good with the yogic practices, like all this yoga, pranayam, they are good. But when it comes to Ayurvedic massages and, Ayurvedic treatment, which is for a chronic disease, like, we just spoke about MS. So there are some Ayurvedic, Ayurveda says that we can cure the MS from the causal, like from the root, but allopathy says we can only control it, we can manage it. And there is no cure in the allopathy for MS. So what do I tell such patients and their parents that, hey, you can try Ayurveda while you are working on allopathy?
Why do you want to listen to anybody? Well, tell them, listen to your body, practice. Do your practice, listen to your body, and you will see the outcome. It's as simple as it is. You talk to different people, they're going to all push their ideas, Your idea is here.
No, that's correct.
Yoga is a work in, it's not a work out. Whole Western concept is work out.
I mean, your doctor is within you, that's correct. But what happens is when it comes to your own blood and flesh, your own family member, you want to listen to the the knowledgeable, like
Sangeeta, I think, I don't know how long we should continue with this topic.
Okay, we'll continue another time, okay?
Maybe I'll just call you.
Another time. Okay, thank you.
Yeah. Thank you, Dr. Sarkar. Excellent session.
Sure, finish it now.
Okay.
Thank you, Dr. Sarkar.
Thank
Very
you.
nice.
Thank you.
Thank you very
To
much.
end the meeting now. Thank you very much, everyone.